Chapter 9, Health Screening and Assessment. Health evaluations are comprehensive assessments of a child's health and well-being. There's many purposes to health evaluations, but one of the main ones you should be aware of is it's to understand children's health status or special health-related needs so teachers can make necessary accommodations for children in the classroom. An example of this would be when I taught kindergarten and I had a little girl in my class who was severely visually impaired. I had to make many accommodations in the classroom for this child to be successful. Some of the accommodations were that she would sit closer to me at the circle time for when I was reading stories, as well as when they were sitting in desks for instruction. In addition to that, I would make copies for her that were enlarged so she could see them better. And I also provided books from the curriculum for her so that she could hold her own copy of the book at story time. And it was a copy of the book that also had Braille in the book. It's also important with the health evaluations to identify gaps in the family's access to needed resources. So if the family doesn't have access to some of the resources needed to ensure the child's health and well-being, then the teacher might be able to make recommendations to resources in the community that could help. The textbook goes over some different approaches to health evaluations. One of the first ones is health screenings, which you're probably familiar with. These would include things like hearing and vision screenings. A lot of school districts do these for kindergarten children so that they can reach more children that way and evaluate which children may have issues with hearing and vision. A health assessment is an evaluation of the overall health of the child, and for the health assessment, this is where we actually evaluate the child in relation to others. So when children go to the doctor for their well visit checks, they are measured for their height and weight and compared to other children so that we can just see if the child is within the normal range for height and weight for their age. There are separate growth charts for boys and girls as well, so you can see if they're within the normal range for their age and their gender. A health history can summarize the child's previous health experiences, and there are a lot of things that can be included in a health history. There's a more comprehensive list in your textbook on page 297, and it's important to note that all teachers won't obtain all components of the health history, but teachers do need to know why each component is important so that they can make use of the components that they do have access to. A child's early development does affect the child's later development. So when we're talking about early development, it's as early as prenatal development that can affect the child into later childhood years. Problems at birth can also affect the child for many years. If a child is born prematurely, they may develop a little bit slower in comparison to their peers who are the same age because they may have been born a month or two early, in which case, if you're looking at an infant's development, if it's a 1-month-old infant who is born 1 month prematurely, then if that infant had been carried full term, that infant would at that point be just a newborn, when in fact they're already a month old. So that does impact their development and at what ages they're going to reach those developmental milestones. Developmental milestones can include physical milestones such as rolling over, crawling, and walking. These developmental milestones, you can get a normative chart that would show the average age in which these milestones typically occur, but there is a wide range of what is considered normal. There are language milestones as well, including when the child begins to babble and speak their first words, as well as following simple directions. Figure 9.1 on page 299 shows some indicators that there may be a developmental delay with a child, and this includes some of those physical and language milestones. It's important to understand a child's history of illness and disease, and if the child has a chronic illness that's still impacting them, it may require a treatment plan or medication administered at school, in which case there may be training necessary in how to deal with the child's condition. An example is asthma, and we've also talked about food allergies. If a child has asthma, there may be limitations on physical activities, and the child may have an inhaler or other medication that needs to be taken at school. There are several immunizations that are required for children to participate in childcare or public or non-public schools. They do prevent the incidence and spread of infections, so immunizations are very important. A copy of the immunization record should be given to the childcare center or school before the child starts attending. That way, the center or school can verify that the child has all necessary immunizations before that start date. Required for childcare, I looked this up online, so it is by state. state the law as far as which immunizations are required. So in Florida, for childcare, the child must have diphtheria tetanus vaccination, as well as the polio vaccine, the measles, mumps, rubella, chickenpox, hepatitis B, as well as the HIV vaccination, and PCV13. So there's quite a few different immunizations that are required for children in childcare, and most of those are also required for children entering kindergarten as well. There is a childhood vaccination schedule on page 311 in your textbook. It's figure 9.4. It's dated 2011, so it's just a little bit outdated. So it's similar to the vaccination schedule that my daughter has been on. She's 18 months now, but it's just a little bit different, I think. So I think you can get that information online for the updated vaccination schedule. Some parents have concerns about vaccinations, and a lot of that has to do with misconceptions about immunizations. So one misconception is that some people think if a child is given too many vaccines at once, that it could harm the child's immune system. But that is not true, that it won't actually harm the child's immune system. And then there's also, you've probably heard that some people think that autism can be caused from immunizations. But again, this has been proven to not be the case. There are some potential reactions that children could have after receiving vaccinations. The most common is a local reaction, which is swelling and redness where the shot was given, and minor pain. Also fairly common is a systematic reaction, such as fever, fatigue, or muscle pain, or headache. And this is fairly common. My daughter, again, she's 18 months old, and she's gotten her vaccinations at pretty much all of her well baby visits. And not every time, but several times she's had a low-grade fever and fatigue afterwards. Least likely to occur is an allergic reaction. It is very rare, but it can be life-threatening, so it's important to realize the symptoms and signs of that. Some of which are trouble breathing, weakness, wheezing, hives, and swelling of the throat. So it is important to monitor the child closely after receiving vaccinations and get medical attention right away if you notice those symptoms. It's also helpful for teachers to be aware of a child's nutritional history, such as child's eating habits, any food restrictions and food allergies, which we've talked about before, and also, again, to make sure that the child's growth is appropriate, so looking at those growth charts, and making sure that the child is getting nutritious and appropriate diet for their age. So fried foods and real fatty or sugary foods should be given to a young child very rarely. The child's oral health history is, again, another component of their overall health and well-being. So it's important to make sure that the child is seeing a dentist regularly. The recommendation by the American Academy of Pediatrics is that children see the dentist by age 1, but you can check with your pediatrician as well. There is not really a consensus on this, so my daughter's pediatrician recommends by the age of 2 that she have her first dental visit. At the first visit, they don't do a whole lot, but they will count the teeth and just make sure that they're in good shape. And one of the most important things for children that are under the age of 2 is just that they begin brushing their teeth twice a day as soon as they get their first teeth. Toddlers will likely want to brush their own teeth, so you can have them begin brushing their own teeth and then maybe just follow up afterwards to help them make sure that they've gotten all the teeth. So that could be at home for the parents, but also for child care programs that teach children how to brush their teeth. Young children can also watch parents and siblings brush so that they can learn how to do that themselves. Again, we're concerned with the child's overall wellness, so we want to pay attention not only to the physical growth and health of a child, but also the mental and emotional health as well. So we want to make sure that children are practicing interacting positively with others, and that they are also practicing to manage their emotions. Young children do have very strong emotions, and a lot of times they can't verbalize how they're feeling, so they need help managing those emotions in appropriate ways and managing conflict with their classmates. This really should be a focus and a goal of early childhood programs, and again, it should not be seen as a disruption from the regular learning, but as an opportunity to help children practice those really necessary skills. The child's family medical history is important because a chronic medical condition of a parent could be inherited by the child, and also the parent, if they have a chronic condition, may have difficulty caring for the child, in which case the teacher hopefully could refer the parent to needed resources in the community. Again, things like poverty, job loss, the child being raised by a single parent, or homelessness, these factors really do affect the child's health and overall wellness. Another example is parental depression can negatively affect a child, their development, because the parent might be less nurturing, and it can affect the parent-child attachment. When obtaining children's health history, it's important to ask specific questions so that you can get the useful information that you are looking for. If the questions are too general, the parent may not answer it as specifically as you would like. Again, it's important to help families feel comfortable when you are obtaining the health history, whether they are filling out a form or if you're sitting down to talk with them at the beginning of the school year. It's important to note things that will impact the child's participation, and again, a plan for administering medication if that is needed. And teachers can communicate with families about the importance of providing healthy foods, time for outdoor play, the benefits of getting enough sleep for children, and decreasing screen time, and teaching children to brush their teeth, all of these health and wellness topics. The children's health history will need to be reviewed by someone who's familiar with the requirements. Again, that sample vaccination schedule's on page 311, but it is just a little bit dated. And it's important to note that there are exemptions from vaccinations for medical, religious, or philosophical reasons. The exemptions that are allowed differ from state to state, but all 50 states do allow medical exemptions. These are for children who might have an allergic reaction to the immunization, as well as other medical reasons. Teachers or other staff at the child care center or school can also confirm that the children have well child exams. These focus on preventative health care and the child's overall development. So when I take my daughter into her regular physician, they ask us questions about, can she follow simple directions? Is she saying some words? Things of that nature. Again, they do measure her for height and weight and share that growth chart information with me to be sure that she is within that normal range. And they do examine her for other issues, and it is nice for the parents and the doctor to have a chance to talk. I usually come with questions about things that I'm concerned about as far as her health and well-being. It's a good idea at the beginning of the day to check in with each child. You can do a daily health check quickly during a greeting time by looking closely at the child and listening to the child and the parent to see if there's any concerns that day. If the child appears ill, you can take the temperature. If you notice any rashes or anything else unusual about the child's appearance, then you can take action as needed. But not only for physical health, but again, the child's overall wellness, you can check in with the child at the beginning of the day to see how they're feeling. Maybe they had a rough start to the day, maybe they're a little tired or angry or upset about something, and the child will have a much better day if you can catch that at the beginning and sort of talk through it with them and then move forward from there.